Here are the precautions of the movements to avoid for posterior and anterior hip replacement. This will prevent any risk of dislocation and avoid any trauma or delay in the tissue's healing. There are three main movements you want to avoid after a posterior hip replacement. The acronym is FIM, F-I-M. F standing for hip flexion. No hip flexion past 90 degrees. So you're not going to want to sit into a deep chair. A stool or a high chair is best. So this is fine. Anything 90 degrees or above is not going to be good for you. The next one is I. That stands for internal rotation. So bringing the femur inward or your toe inward is not something you want to do. The last one is M, stands for midline. Do not bring the operative leg across the midline. So no crossing your legs. And when you're lying down, again, no crossing past the midline. The two precautions for anterior hip replacement are double E. The first E is external rotation. That's the opposite of the precaution for posterior, which was internal. Now, external rotation with the toe and the knee pointing outward is something you want to avoid. And the second E is excessive extension. Again, the opposite of flexion. So excessive extension as you're standing up or walking. You don't want that leg to go too far behind you. And then for both procedures, you want to make sure that you lift your feet when you step or turn, and that you're not keeping the operative foot down and pivoting on that hip. These precautions are usually mandatory for the first 6 weeks after your surgery, and then 6 to 12 weeks, you can gradually start to move into those ranges of motion. But your doctor and your surgical team will advise you on your personal precautions.